Happening now, new developments in the war on Ebola. The international community joins forces to stop the infectious virus. What are world leaders planning to do? While the U.S. struggled to contain the Ebola outbreak, Nigeria and Senegal were declared Ebola-free. What did those countries do that the American government has not? We'll take a look. Our analysts are standing by. We want to welcome our viewers in the United States and around the world. I'm Katarina Rabidi, and you're in the Intern Newsroom. The World Health Organization is giving Nigeria and Senegal the all clear, with both countries going 42 days without a new case of Ebola. Meanwhile, the U.S. government has wrestled with preparing hospitals, CDC procedures, and quarantines. Our newsroom correspondent, Zincle Esamoah, has the story.
That's right, Katarina. 9 months after the CDC issued its first announcement on an Ebola outbreak in West Africa, the virus has claimed over 5,000 lives and continues to spread throughout the world, including several cases in America. The spread of Ebola in the U.S. has Congress, healthcare workers, and communities asking what went wrong and why.
America, home to the most expensive healthcare system in the world, and yet not immune from the dangers of Ebola. 2 victims of the disease were nurses at Texas Health Presbyterian Hospital, contracting the virus from Thomas Duncan, a Liberian man who had just returned from his home country. Dr. Thomas Frieden is the head of the Centers for Disease Control.
We wish we had done differently. The bottom line here is that Ebola is hard to treat. And when the first patient ever with Ebola came to the United States, we thought the guidelines would protect the healthcare workers.
But even with these guidelines, the Ebola virus spread in the U.S. Some experts say the CDC should have expected that very thing, with the Ebola crisis raging in West Africa and transit between the continent and the U.S. remaining relatively unrestricted.
This is a humanitarian crisis of epic proportion. The first cases occurred last year. This reached the international radar in April. And the inaction by rich countries, by most humanitarian agencies, by the U.S. government, that has a toll in thousands of lives.
Dr. Jesse Bump is an infectious disease expert and has consulted for the World Health Organization.
You will always need a functioning health system. Ebola highlights the need for a functioning health system.
Since nurses Amber Vinson and Nina Pham contracted Ebola, healthcare workers around the country have protested, saying their equipment and training is inadequate to confront the virus.
Are they right in saying that?
Well, I think it clearly shows that they have serious fears. And since they are the people that have to work directly with patients, those fears need to be regarded and respected and addressed.
Dr. Julie Fisher, associate professor at the George Washington University, specializes in infectious disease and emergency preparedness.
We can do a much better job of risk communications and helping people understand how to protect themselves and making sure that they're confident and have the tools and the equipment they need to do so.
While the number of new Ebola cases is on the decline globally, American doctors treating the crisis will continue to return from West Africa, and health officials say some will inevitably bring the virus with them. One thing is certain, Ebola isn't going away anytime soon. Katarina?
Thanks, Zincle, for that. The World Health Organization, in conjunction with world leaders, is looking to stop Ebola once and for all. Joining me today to discuss the topic, George Washington student Brooke Zahner. Brooke, let's start with the first question. What do you think is currently being done to improve the medical treatment of Ebola in West Africa?
Absolutely. You know, the international community as a whole, we've seen has really stepped up, and they've risen to the occasion that this is a serious epidemic that we need to deal with. You know, the Dutch Navy is one of the perfect examples, as they sent one of their largest ships filled with medical supplies, medical personnel to West Africa to help. Tony Abbott, the Australian Prime Minister, also gave $20 million in Australian money to help to this cause. So I think overall we're seeing that the international community sees that this is a problem and they see that there needs something to be done. I think the most important thing though is that they maintain that momentum, because that's what is going to keep this going, and at the end of the day the goal is to get 0 Ebola patients, which is incredibly hard to do.
What can you say the U.S. government is currently doing to make sure that this Ebola doesn't come over to the United States and spread like it's been spreading in West Africa?
Absolutely. Well, President Obama recently asked Congress to set aside $6.1 billion in emergency Ebola funds. And that's for West Africa, and that's also for us to prepare ourselves in case we do get another case. Because like we saw with Thomas Duncan, it's not completely delusional to think that it could happen again. Also, researchers we've seen have been testing out different vaccinations, finding something that's going to work that we can send over to Africa and to some of these countries to help out. So I think the United States as a whole has a huge part in this. We have some of the best medical people in the field that could really help aid to this.
And since the first Ebola diagnosis here in the United States, what procedures have we seen taking place in these hospitals? Some of them were not prepared, and now the CDC has issued procedures that need to be changed. What are these hospitals in the U.S. doing to prepare?
Absolutely. That's a really good question, because Thomas Duncan, like I said, was a huge, huge wake-up call for Americans. And I think it kind of showed how unprepared we were. There were so many hospitals that were scrambling. What would happen if there was a case here? What would happen if there was a case here? One of the perfect examples of that is Griffin Hospital in Connecticut. They had a man come back from Liberia. They thought he may have Ebola. He's showing signs. He ended up testing negative, but it got lawmakers thinking, what would have happened had he tested positive? Are we truly ready for that? Are we truly prepared? So I think lawmakers, for one, need to stay vigilant. They need to stay aware and keep their hospitals prepared. The CDC, like we saw with Thomas Duncan, was in a scramble. We didn't have guidelines. We didn't have anything in place to say, what do we do? How are we going to, what gear are we going to use? So some of their new guidelines have been emphasizing the complete coverage of the body, keeping every single part of your body covered. And then instead of reusing things like goggles on the face, we've been seeing more movement towards a single use of things so that you can just dispose of it and so you don't get contaminated. But the only problem with that is that when the removal of that equipment is much more challenging when you have more. And when it touches the skin, you could get infected. So it's kind of been a trial and error run for Americans, absolutely.
Absolutely. Thank you, Brooke, for joining us today. Next, the numbers are staggering. What can we learn from the rate Ebola is spreading in West Africa? Stay right here. I'm Katerina Rabidi, and you're in the Intern Newsroom.